here but B's had whiplash. Okay, so just in case you ever do though, okay, or in case you have friends that have had it, it's really good to understand it because there's a lot of really, really good science behind the whole whiplash problem, and it is a problem. This thing looks like it's going to be a problem. It worked so well last time. Okay, so let's. All right, so here's the journals that I got this entire talk from. Is these 8 journals, and there's more information out there than just this, but these were, and there's a lot of there's some overlapping information in these journals, which shows that a lot of the information out there has been really studied pretty well. And if you look at whiplash injury, there's 3 whiplash cases per 1,000 people in the United States, which means there's 330,000 cases a year, which is a lot. Come in. Good to see you, Sumta. So here's something that should be pretty obvious to a lot of people, is women tend to get injured a lot more than men in car accidents. And the reason is they have thinner necks. You know, they don't have the musculature around their neck. So the head size relative to the larger head size relative to the neck size. So when you're in your car, if you can adjust this to where it touches the back of your head and you're hit from behind, you have a much less chance of getting a whiplash injury, because what happens if these two are touching and this is higher, it's going to be support your head. If it's not, your head's going to whip back, and if this is too low, it's a really hard hit, your head will actually go over the headrest like this, and it'll even be worse. So, awareness factor. Occupants who were unaware of the impending collision were 15 times more likely to have symptoms 6 months after the impact. So if you see somebody that's going to hit you from behind in your mirror, it's really good to just stiffen up and hold as hard as you can. Your chances of getting injured are way less. Speed change. So a speed change of only 2.5 miles an hour gave 29% of accident victims symptoms. So you don't have to get hit hard at all. The numbers were changed to 38% when the speed change was only 5 miles an hour. So imagine what happens if you're at a light and you're just getting ready to go and somebody hits you at 40 miles an hour and your car jumps ahead at 10 miles an hour. That's a lot of damage to your neck. And people don't realize that. Age of the victim. So advancing age is a poor prognosis for whiplash injury. So if you're over 41 and you get hit, your prognosis is worse, okay? Even minor accidents can produce lasting effects in the elderly. And a lot of older people have a breakdown in this. They've been through a lot of stress. The adrenal glands are not working well, which help with inflammation and control pain. And that can cause chronic problems with a whiplash injury. Motor vehicle crashes are the second most common form of traumatic injury to adults over 65. What do you think would be first?
Falls?
Yeah, that's what I would say. Falls, exactly.
What?
What?
Idiot? Do people fall a lot?
Fall.
Oh, 65,
Yeah,
of course.
yeah.
I didn't pay attention to that.
So rear end collisions account for 71% of whiplash injuries, side impacts 19, frontal impact collisions 10. Now here's something that is important to know. So if you're driving in a car and your head is turned and you're looking and you get hit from behind, that's a much worse injury than if you're looking straight ahead. So now you're tearing and you're disrupting what are called the uncinate joints in your neck. And the chances of getting a ligament tear are much higher if you're looking from side to side. And so on my intake form for car accident injuries, one of the questions I have is, where were you looking during the accident? Because if you're looking out your side window and you get hit, the chances of a worse injury are a lot higher.
You probably don't remember. It's such a stressful time. You don't. Now I have a question. In multiple car accidents, there were 3 car accidents. My son was in the last one, number 3. What is the impact?
It depends on how hard he was hit. You know, if he was hit hard enough to jolt his car up to 2.5 miles
He's the
an
one who
hour.
hit the.
He was the one who hit?
It was a multiple car. The first car, we don't know what happened. Then the second car hit the first car, and then my son hit the second car. So 3 car accident. He was the last one in the back, and the front was actually the gosh, I forget the name now.
Why don't you ask me that question after
Okay.
the talk?
Yeah.
Okay. Okay. 89% of all people who have a whiplash experience the following: neck complaints of pain, stiffness, and tenderness, along with neurological signs that include restricted movement in the neck, tenderness in the neck upon palpation, and you can actually get radiating pain down your arm as well. So symptoms include neck pain is 100%, headaches 52%, dizziness 45%. I see a lot of this, a lot of all 3 of those with whiplash injuries. Another thing that I see is nausea. People come in and they've got some nausea after a whiplash injury. Why would that be? What would cause nausea after a whiplash injury?
Balance.
What?
Balance.
Okay, so it could disrupt balance here, but you also have the vagus nerve, which comes across here and down here. So if you whip back and you stretch and disrupt that vagus nerve innervates the entire GI tract. So that would also cause nausea. I see a lot of TMJ pain after accidents. So 31 to 59% experience moderate pain, and the other 40% experience severe pain. 6 months after an accident, and now I don't know if this is after people have been treated or if they've just left it alone. 56% have mild pain, 35% have moderate pain, and 9% have severe pain 6 months afterwards. So what's a recovery prognosis? The presence of dizziness in a whiplash injury is a poor prognostic factor in recovery. Visual analog scale score, this is like you're rating the pain. If the score is above 69, it's a poor prognosis. Female, poor prognosis. So you got a female that's dizzy after an accident, prognosis isn't as good. Okay. Now again, these figures came out of journals where these people were not necessarily being treated with chiropractic, so, or laser, or all the things that I use. So if these are just medical, people are treated with pharmaceuticals, I can see how that could happen. But I think I have a much better success rate in my office, at least, treating people the way that I treat them. I don't get every whiplash victim better, I just don't, but I get a lot of them better. And most of the ones that I can't get better are usually women, older women. They're the toughest ones to get. They can be really challenging. Factors unrelated to 6-month recovery. So if they had pain before the accident, it's completely irrelevant of the pain after the accident. And psychological illness before the accident is no bearing on whether they recover or not. Okay, so let's look at chiropractic versus pharmaceuticals. In whiplash-related injuries, ligaments are normally stretched beyond their physiological limits or suffer tears. So this would be a pretty serious tear where the disc is actually torn. Why is this important to know this? Anybody? Nobody knows? Okay, ligaments are very, very well innervated. So when you tear a ligament, you've seen football injuries, haven't you, where people tear, like, medial collateral ligament on the football field or an ACL. Do they just get up and walk off? No, they sit there and writhe in pain, okay? And the reason is because ligaments are so well innervated, okay? They have a very, very rich nerve supply. So why would they have a rich nerve supply? And I've asked this question before in some of my talks. Why are ligaments so well innervated? Anybody? Nobody remembers, okay? So ligaments, they have to be innervated because they tell your brain where everything is in space and time. So your ligaments in your neck are feeding information into your brain, so your brain knows your head's down or up or left or right. And so they're well innervated because it's the ligaments in your body that tells your brain where the body position is. So when you get a ligament injury, that really hurts because it's so well innervated. So the healing of a ligament takes a long time, and it occurs in phases. Okay, so you have acute inflammation. So you have this random cheap grade of scar tissue that begins to form collagen. So it does not form in the exact way that the ligament that you are born with. Okay, and that's within the first 48 hours. And so collagen in the next 6 weeks is laid down in a disorganized fashion. Well, we know that. Everybody's seen scar tissue before. Some of you have it, okay? Does a scar tissue look like your normal tissue? No, it doesn't. Because the way that scar tissue is laid down is disorganized compared to normal tissue. Now, one of the things that you can do, and it's really, really important, is to make sure that you're able to move the joint some after the injury. So remember how they used to put collars on everybody that was injured? You know what they found out? There weren't any studies done on that, and they found out people didn't do very well with those things. You know, the scar tissue was worse, that the motion in their neck was worse if they put on a collar and stabilize it after the injury. And so I'm not saying you should never wear a collar. If you have a real unstable, if you have a fracture in the upper part of your neck, yeah, you definitely want to wear a collar because you don't want that to start moving around. But for most injuries, you don't want to wear a collar. You want the neck to move because the tissue heals better when there's some motion. So 1 year or longer, you have tissue remodeling. and it never regains the original property. So anytime you have a torn ligament anywhere, the area is weaker, it's more pain sensitive, and it's more subject to re-injury. And that's especially true with your neck, okay? Now, with your ACL ligaments, some of the sports injuries, they're doing a lot better at fixing those. And those athletes, to me, it's amazing. Like, Tom Brady had an ACL tear, and, he was out for a year, and he came back and won several more Super Bowls. I mean, that's pretty amazing to me. So, the athletic injuries are they're doing pretty well with, but when you get a bad neck injury, it's just not going to be quite the same. So the injured ligament must be mobilized to heal properly. And chiropractic has its greatest benefit during this phase, as when we adjust the joints, we're literally mobilizing that area and causing it to heal better. And if you take pharmaceuticals, okay, which a lot of people are prescribed these after an accident, they dull pain, they decrease inflammation, but they don't do anything to assist the remodeling process. And what happens when you kill the pain in an injury?
You can injure it worse.
Yeah, you don't think you're injured anymore, so you go out and do things that could make it worse. And that's what pharmaceuticals do. Here's another thing. There's multiple studies have shown that using these non-steroidal anti-inflammatory drugs like Tylenol and aspirin and ibuprofen, it slows the healing of broken bones, damaged ligaments, and other tissues. Actually slows the healing. So why is that? Well, why would it slow the healing? Anybody? I mean, they're doing what they're advertised to do. They block inflammation and pain. Hi, Terry.
Hi, Paul.
So why would taking these pharmaceuticals slow the healing process?
So they're not addressing the root of the injury.
Okay? They're definitely not doing that. They're just covering up pain. But why would they slow the heat? Why would it slow it down? Okay, here's the answer. Because inflammation is a key part of the healing process. You have to have inflammation in an injured joint. And if you take away that inflammation, the joint cannot heal. That's part of the healing process. Now, when inflammation is completely out of control, if you get your eye, you have a huge inflammatory response and it starts destroying the retina, yeah, you need something to control that. But for something like a whiplash injury, you need an inflammatory response to jumpstart the healing process. And if you take drugs to stop that, it's going to go a lot slower. So healing from a whiplash injury should include the following. Okay, if you're gonna have a whiplash, chiropractic care. You got to correct the misalignments, the subluxations, fix the neurological issues, and mobilize the joints. Low-level laser. There's really good research that shows that laser helps the body manage inflammation in a healthy way, reduces pain, and speeds healing by upregulating cellular function, so the damage to the cells. Cervical traction exercises, very important in restoring the curve of the spine. And then you look at supportive nutrition. There are some things that you can take that can really help you heal if you have a whiplash injury. Okay, I've done a talk on essential amino acids. It rebuilds tissue. You've got to have your 8 essential amino acids to rebuild muscle, rebuild ligaments, rebuild any tissue in the body, any protein. Whole food vitamin C, collagen, Your ligaments are primarily made of collagen. Turmeric boswellia, really helpful for controlling pain. Minerals, essential for building new tissue. And if you have trauma, any trauma to the brain, the research shows that omega-3 fatty acids are essential for healing any trauma to brain tissue. Okay, why is that?
The brain is mostly fat.
Yeah, you've been listening to me.
Yeah.
Yeah, your brain's a big ball of fat, basically.
No brainer there.
Yeah, right. So you got to have the right kind of fat in your brain, otherwise it's just not going to work right. And so if you've had damage to your brain, that's one of the best things you can do is really tank up on omega-3 fatty acids. So I just want to show you something, and I want to ask you this question. When somebody's got a whiplash injury, here's a normal neck. So when they're hit from behind, the first thing that happens is this part of the neck here deforms and curves forward. The upper part of the neck starts to straighten out. The head whips back, okay? It whips forward, and you end up with this reversed curve. Now, a lot of times when you have a whiplash injury and everything's over within a fraction of a second, you end up with a loss of your curve in your spine. And this is how it happens. And we actually have, I wish I had there's a video that kind of, I don't have it, but it actually shows exactly what happens in a whiplash injury. A guy by the name of Art Croft, a chiropractor out in California, actually did whiplash injury, or he actually did car crash studies and showed what happens. So you end up with a reverse curve. So the question I have is, who do you know that has suffered from a whiplash injury is not healing properly? It's not healing right, because that's where chiropractic care and nutrition and laser can come in and really help those people. And there's a lot of people out there like that. They're not getting better. And when you have a reversed curve in your neck, what's the result of that? Anybody know? Reverse curve? Anybody remember the things that I've talked about?
The blood supply to the brain is diminished.
It's one thing, yeah.
Nervous,
Blood supply to the
nervous.
brain is
Yeah.
diminished, right? What else? At least my CA remembers. She's seen every one of my talks. Anybody else? How about the stretching of the spinal cord? The spinal cord should follow the curve of the neck. When you have a whiplash injury and it comes back like that, it's stretched, okay? That really alters the messages from the brain to the body and the body to the brain. And that's what happens when you get this situation here. So there's a lot of people out there that are suffering, and they don't have to. They're, chiropractic can help them. And you may know some of those people who had whiplash injuries, and they don't know what to do. They become chronic after a while. And there's those patients a lot of times can really be helped with chiropractic care and laser. And it's too bad that they have to suffer like that. And you may know some of those people, and we'd be happy to just check them out and see if we can help them, see if there's something we can do for them. There's no reason for people to suffer when they don't have to. So, anybody have any questions? Yes.
Anything to do with so many people that go into dementia?
Let's go into after.
Absolutely. Absolutely it does. And if you cut off blood supply to the brain, yeah, it does. And when you disrupt just the central nervous system, that's going to definitely affect people. Yes, Terry?
When you have whiplash, are your ligaments stretched one way and then stretched another way in reverse?
Yes,
And that's what makes it,
stretched or torn, yeah.
okay, next question is, when they wear a brace, is that really a neck brace? Does that really help?
Were you here when I talked about that?
He wasn't
Well, I
here yet.
came in
Yeah, you came
like
in
10
late.
minutes late, yeah.
So no, it makes it worse.
Oh, gee whiz.
Makes it worse.
Oh, man.
So unless there's instability, unless you fractured like the atlas, you know, the top bone in your
Oh,
neck.
yeah, that's dangerous.
If you fracture that, you need to wear a neck brace. You need to get surgery.
That
And
could
that's
be-
a surgical issue.
Yeah.
But neck braces, no, they're not helpful at all. And I used
That's what I
to
thought.
I used to give cervical collars back in the 80s. I didn't know any better. We didn't know.
Right.
Back 70s and 80s, I got into practice in the 80s. I used to put people in cervical collars. It was stupid. You know, I didn't know any better. I do now. I wouldn't go near them now.
Another question, you can go to a pharmacy and get one of those fluffy, it's like a carpet, but I mean, it's really padded, and you can wear that. And for those that have done that, I don't know how they sleep with the brace or with the padded type thing.
Yeah.
I mean, these are people doing their own whatever.
They're doing their own rehab, and they're
Yes,
hurting themselves.
Yes.
They're hurting themselves by that because they should be wearing those.
No,
Yeah, they shouldn't be wearing those at all.
no, it makes it miserable trying to turn over and roll around and,
But their neck needs to move. The
yeah.
joints need to move for
Well,
those ligaments to heal
It cuts
properly.
down on the blood flow too, and that's
Yeah.
not good.
So, okay, any other questions? Okay, everything clear as mud. Okay,
Yeah.
good. All right, so what's our next talk?
Let me look.
Oh, we have to look here.
I have to look because you've only got one up here. Opioids.
Opioids. So
Opioids, yeah.
if you want to learn about how this whole opioid epidemic started, and how it progressed, and how one family is responsible for the entire epidemic, come to my class. I'm going to go over that next time, and you're going to find out the whole thing on how it happened, the whole history of it, and the one family that's really responsible for it, for the opioid epidemic.
We want to kill them.
What?
We want to kill them.
Yeah. Well, I mean, they're one of the richest families in the country actually now, and their government's after them. But I'm not going to give all that away. You have to come for that talk. Okay. Good. No other questions? Thank you for coming tonight, and I'll see you in 2 weeks. Okay.